I'm Kelly Cantrell. I am a Deputy Administrator with the Division of Welfare and Supportive Services. So once a year, Medicaid eligibility is re-looked at, it's rechecked. And the reason for that is to check the status of someone's eligibility. And many people will be renewed automatically using information that's available to the state. If that can't happen, a packet is mailed to the customer, and the customer would need to watch their mail for the packet and any paperwork that comes with it. They would need to complete the paperwork and provide anything that's requested from them, whether it's proof of income, tax filing status, maybe a household situation, and they need to get that information back to us by the date that's on the packet. That it'll tell them when it's due, and they want to get that paperwork back to us by the due date to ensure that they don't lose coverage. So generally speaking, it follows the month that an individual applies for benefits. So if you applied in January this year, chances are right around January of the following year, and it's usually a little bit before that, a packet gets mailed out. And so if you've gone a year and a half, 2 years during the unwinding without having to provide this packet, just know that in the next 12 months you're going to receive one. And then it should be around the same time every single year after that. So the biggest determining factor of eligibility, honestly, is income. So you're either over the income for the program or you're within the income limits for the program. And depending on how old a person is, depends on the income limit that you have. So for example, a child has a higher income limit than an adult, but a child 5 and under has an even higher income limit than a child 6 to 18. And so income's the biggest factor. Another reason people lose coverage is because they don't provide paperwork that we request from them. They could move out of state sometimes, and we get a notification that says, hey, this person no longer lives in the state, and then we follow up to try and determine, and in that case, that you could lose eligibility that way too. So those are really the main ways that a person would lose eligibility. Okay, so once you have the packet, it'll ask you a series of questions. You want to make sure that you go through and answer all of the questions. And if you've had a change in income, let's say you didn't have a job and now you do, you would just take your last, I would say at least 4 pay stubs, even 6, and I would make copies of the pay stubs, attach them to the packet, and mail the pay stubs back in. If you had a baby, you might want to attach the birth certificate or the new Social Security card, and you would attach that to the packet and you would mail that back in. Anything that changes, if you can provide information to us with the packet, it would keep us from having to re-ask for something. Because if we send you the packet and you send it back and we recognize changes, and the changes aren't verified with the packet, we're just going to turn right around and say, okay, hey, you reported this baby, but now can you provide us verification of the baby? What's the name? What's the date of birth? What's the social? Stuff like that. So the more things you can provide that match the changes you're reporting, the more likely it is for us to get you approved for your renewal timely, or even in a new case of a new application. So there's a few easy ways to do that, and I'm gonna say Nevada Medicaid created an app. It's a Medicaid app, and if individuals get this app on their phone, they can check the status of their Medicaid, they can check they can have a digital Medicaid card. So if they're at the doctor's office, and it's easy to lose a card, right? A physical card. But the app, it stores their digital card and they can just show it to providers, pharmacies, doctors, etc. They can certainly call customer service, the welfare customer service phone number. They can walk into any welfare office, and there's 22 throughout the state of Nevada, north, south, rural, we're all around the state. They can even honestly email, and we have Access Nevada, which is an online portal that if they sign up for it and link their case, they can see many things, almost everything that has to do with their case. And so there's multiple ways they can do that. Sometimes there is, and honestly, I can tell you one of the barriers that we've seen that we're working on, and it is getting better, is internet access. And so we have this great portal online, and then someone who's maybe in a real rural area may have difficulty accessing that because they don't have a good connection, right? And so that's a challenge. Having a physical person in a rural location is another barrier, in my opinion. However, we have started a new thing where we're going into a community, we're hiring from within the community to then serve that community. And that's in its pilot stages. We're starting in Yerington, and we've just hired 2 individuals from Yerington to service some of that surrounding Yerington area. So believe it or not, many individuals don't know that they're ineligible until they go to the doctor's office and the doctor says, you know, you don't have coverage for this appointment, or they go to the pharmacy and try to get a prescription for their child and the pharmacy says, I can't give you that prescription because you're not eligible, you're not showing eligible. So that is how many customers discover they're not eligible. But I will tell you that with every action we take that is a change to eligibility, we send a letter. It's a letter explaining either your household's eligible, your household's not eligible. And those can be hard to understand, and we know that. And I know sometimes mail is received from the welfare division and maybe people don't open it or look at it because they think the status quo is okay. But if I can encourage individuals to open that mail, look at that mail, even just to see either A, are we asking for something, or B, have I lost coverage? I think that would be great information to get out. Just look at what we send you, glance at it, because that's the first way you're going to know. And we send those letters full 2 weeks. It's actually more than 2 weeks prior to the coverage end date, when there's still time to rectify the problem and have us try to help you if we can, unless you're over income, and of course that changes things. So the number one factor for not being renewed is either failure to provide the renewal packet itself that we send out, or failure to provide that supporting paperwork that we would need to verify your eligibility status. So you report you have a new job, and then we request pay stubs, and we never receive proof of that income. Now my eligibility workers will attempt to get that from employers, but not every employer will provide that information to us. And so it's just really important that if you get a packet from us and we're requesting something, try as best you can to provide what we're asking for. And if you're not sure, call. Please give us a call and we'll help you understand what we need. Yes, so I'm excited about continuous eligibility. So starting in January of this year, there is a new law that came into effect that says children under the age of 19 have to receive a guaranteed 12 months of coverage, with a few exceptions, from the time they're renewed until their next renewal status, regardless of income, regardless of parental cooperation. They just stay on. It's just to ensure that kids have that continuity of care, meaning they don't lose coverage, that they stay covered for that 12-month period until it's time to renew again, when we can check it. So essentially, when you hear the term continuous eligibility, it just means we're ensuring children stay eligible from renewal to renewal, and they don't lose it based on cooperation or income status. It's important for children so that any sickness that comes up is handled, but even more than that, for preventative care, meaning checkups to say everything's okay, blood work to know that your child hasn't developed a disease or an issue that they can catch early. We hear often we'll see customers that come in frantic with a sick child that has cancer or some other awful disease, whereas if they could have had coverage ongoing, they could have maybe received preventative care, that they could have caught it early and it wouldn't be such a crisis at the moment. It's crisis no matter what, right? Cancer is a crisis no matter how you slice it. But if we could catch that early, instead of maybe somewhere in a stage that none of us wants to talk about, it can really help. Things like that. And the healthcare is it's a determining factor of a person's overall life success. It just makes a big difference. We want every child in Nevada that's eligible for coverage to be on coverage. So if you lose Medicaid, the first thing you want to do is get a new application to the Division of Welfare. You can do that by going into an office and submitting an application, or going online and submitting it through Access Nevada. Honestly, you could also email or fax an application into one of our offices. If there's been any gap in coverage, like say you were terminated in February and you didn't realize it until April, you can request up to 3 months of back coverage. So you have 90 days to reapply to avoid a gap in coverage, because we will cover 90 days. So the most important thing is just to get back with us and reapply so that we can get your benefits established again. Okay, so when an individual is no longer eligible for Medicaid because of income, excess income, the Welfare Division does an automatic referral over to the state exchange. And what the state exchange is, or Nevada Health Link, you'll hear that term, it's a website that provides options to purchase low-cost health insurance. And they have a variety of plans and a variety of coverages to suit individual needs, and plans start as low as $30 per month. And so when Medicaid is lost due to excess income, that referral goes over and someone from the health exchange will reach out to you to let you know that they're there to assist you with purchasing a plan if that's needed. If anyone has questions about their Medicaid, they can call 1-800-992-0900, extension 47200, or they can go online to accessnevada.nv.gov.